The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, hot topic, what you need to know if you're considering bioidentical hormone replacement therapy. With us, we have an expert on the topic, Dr. Ann Peters. Dr. Peters, welcome to the program.
Nice for having me, Randy.
Now, a very interesting topic, and before we get into it, let's talk a little bit about your center, or centers. You have a few. Tell me about it.
Yes, I have one in New York, which I'm going to start pretty soon. I have one in Gold River, California, and another in San Francisco.
Okay, now by the way, what do you call it? What kind of medicine is this? Is it holistic medicine, anti-aging medicine?
Well,
what do you call it?
There's all names for this, but what I like to call this is age management medicine.
Age management medicine.
Yes, so you function and feel the best you possibly can.
Now you have a saying, and I like what you said. You said, in fact, it's on your website, feel well, look well, live well. Expand on that.
Yeah. Feel well. So, it's more of function. So you feel, you could perform the way you would like to when you're in your 20s and 30s. And look well. A lot of my patients do aesthetic procedures to look younger and
so they've had cosmetic
more
surgery.
Youthful. Yes. So then this is.
But they feel old.
That's right. So this is.
Is that right? Did they tell you that?
Oh yes, certainly. So they feel they look well, but they want to function and perform that matches the way they look.
Okay.
And of course, so that they could do the activities they love doing in their 20s and 30s.
Now, for people just tuning in, we're talking about bioidentical hormone replacement therapy, but as you call it, Dr. Peters calls it hormone optimization. You say it's not just about hormones, though.
That's correct.
For longevity.
Certainly, it's important. Nutrition, very important. Fitness, so exercise. Then we have critical supplements, vitamins that are crucial to our well-being, and also stress reduction. So that, together with hormone therapy, I would say completes the package of someone.
How soon can the patient start feeling better?
Oh, that's a good question. Probably, I have my patients tell me in 2 weeks maximum, they already notice a difference, more energy, more endurance. They have a better outlook on life. So,
really?
So they are very happy people, yes.
Is it more men than women or more women than men?
Well, initially I used to have more women because they used to bring their husbands in, their significant others in. Now I have more men, actually, that come in to see me, and they start bringing their wives in.
And they
so
want
I
that
would say
edge.
half and half.
Both people want that.
Oh,
edge. They want to
certainly.
feel great.
Oh,
Is it
definitely.
true the number one reason why people go to medical doctors is lack of energy?
Oh, definitely. Lack of energy, endurance. They not as motivated as they used to be. They don't have that edge.
You say that they get more energy, but scientifically, what's going on? Why with hormones and putting it all together? I mean, what's going on physiologically that makes it more energy?
Well, let me tell you this: all the hormones that we naturally were born with, right? Meaning testosterone, growth hormone, thyroid. We all have receptor sites on every organ of our body. Okay. Now, as we age, our hormones decline. Okay, so
as you get older, the hormones start going down.
That's correct.
In everyone.
That's correct. That's correct. So as we replace them, we function better because when we were in 30s, our hormones levels were much higher than it is when we
when you say
are in our
replace,
50s.
Are you talking about replenishing them in a way?
Replenishing, supplementing.
So by giving them back,
yes, exactly.
They start feeling the way they
certainly supplementing your hormones, optimizing them to the optimal range.
Do you think you're slowing the aging process?
Certainly, yes. Yeah, we're slowing the onset of age-related diseases, by optimizing your hormones, and that means optimizing your endocrine support, right, so that you feel and function better. I'll tell you that, I have couples that come into my practice, and the level of the male testosterone, or actually the male estrogen, is higher than the female estrogen, right? And that's why we have andropause. The decrease of the testosterone in men. And the increase in estrogen is the problem.
So how do you lower estrogen in men?
Yeah, so we have quite a few things. We have a way to do it clinically. We do it by an enzyme inhibitor that prevents the conversion, too much of the conversion of testosterone to estrogen. and we get the ratio of your testosterone to estrogen just right, so that you don't have things like enlarged breasts, in men as they get older, abdominal girth increases.
Do they lose weight on your program as well, as a side effect?
Certainly.
They go to you to feel better, but
that's part of the whole process. Yes.
Okay.
Because as you optimize your hormones, you gain or maintain your lean muscle mass, and you lose fat. Okay. So you fit better in your clothes, and you feel better. Yes.
Okay. 3 things you say: nutrition, fitness, bioidentical hormones. I want to talk about the commonly replaced hormones, but you also have 3 different types of programs.
Yes. Yes.
Within your practice.
Certainly, yes. The first program is hormone replacement program, where I replenish all the hormones, the critical hormones, except growth hormone. Okay, and then there's a second program which is called the age management program, where patients could avail themselves of all the hormones, including growth hormone.
And then your third
program? The third program is a consulting program to patients who not only want to avail themselves of the inclusive of the first 2 I mentioned, which is all your hormones plus growth hormone, but genomic testing, meaning that we want to look at genetic predispositions to diseases to prevent them.
So these are for people that really want to take it up
to the next level. Yes.
Okay, genomic testing,
you say? Genomic testing, we have stem cell banking for those who want to use this in the future. We look at all organ systems. So if you have a family, history of a certain
like breast cancer
disease,
or whatever,
breast cancer or heart disease, or any sort of cancers, we try to find out whether you are prone to having that, and be very aggressive in therapies to prevent this from happening, because you don't want to follow those footsteps.
I mean, you have a chart that shows your progress. So you show this to your patients. What are we looking at?
Well, here's what I show my patients, that these are all the different hormones here. And you could see just a cumulative look at what the levels could do over a period of years.
With testosterone, in 08, they were at that level.
That level. And then
so the numbers on the left are missing.
That's right.
For this, okay.
So this is the change that could occur over a year.
Is that too high, though? That seems like a pretty high bar.
No, it's not too high at all, because first of all, we don't see the numbers here. Somebody could start with a testosterone of 300, a male, but the optimal is around 700 to 800.
So everybody should get tested, though. Everybody should know, like every man watching this should know what their testosterone numbers are.
Definitely.
Or women.
Definitely.
But women really need testosterone?
Definitely. Oh, really? Yes. Women have also low libido, so they could benefit from testosterone. Not only libido, but cardiac function, because we have receptors for testosterone on our heart muscle. So we function better, and our heart muscle.
Is that one of the reasons why you have more energy?
Oh, definitely.
With testosterone?
Yes. And how about the lungs? You have greater lung capacity, so you could perform better if you optimize these hormones.
So all of this, okay. So I understand this correctly. They come in, you do your evaluation, do some blood work, take care of their nutrition, get them exercising, the smart kind of right kind of exercise.
Certainly.
Hormone optimization. And then you retest, and then you show them this chart.
That's correct.
Okay.
That's correct. And then invariably, all my patients, this is the progress I see, where the levels increase, over time.
How often do you test?
I test periodically. In the beginning, maybe the first month, then then third month out from the start, and then every 6 months or so. Now, if a patient is doing very well and they have optimized their hormones and they feel great, then I do it maybe every 10 months, 10, 11 months or so. So but it's a matter of periodic monitoring and keeping your levels where you feel your best at, all the time.
So you say this is a holistic approach to aging.
Yes. So when I say that, I mean that we do not rely on pharmaceuticals, drugs to feel better. We do things that we should naturally be doing in the first place to prevent diseases.
So that, as you say, so I understand this correctly. There's diseases associated with aging.
Yes.
Like diabetes, heart
disease
things like that.
Every disease.
Okay.
There is.
You're saying you can push that out. You're convinced.
Oh, certainly.
That you could push that out.
No question.
Farther out.
No question.
Really? Is there science behind any of this?
This is all evidence-based medicine, all science-based medicine. All the clinical medical journals in America, in Europe,
when you hear somebody say, and my father, Okay, and I'm talking about you before the interview.
Yes.
He's 74, he's in good shape.
Yes.
He feels lousy, and he always says, hey, if you live long enough, your body starts breaking down.
Certainly.
And so when you hear them say that, it's just part of age. So you don't believe that? It doesn't have to be that way?
No, it does not. No. This is what conventional medicine wants you to believe, that this is part of normal aging, but it's not. It's unacceptable.
Do you think you're going to live to be 120? Possibly?
I don't know. It'd be nice if we...
But you think over 100? I mean, is that the goal here?
Oh, certainly. Well, we have already centurions, right, that live over 15 years old.
But at 90 years old, the quality of life is pretty bad. You're saying you start early. Or you're not saying, I'm putting words in your mouth here, but is this what you're saying, though, or your belief?
Oh, yes, definitely.
That if you start in the 60s, 50s,
that
you can slow the aging of the organs.
Sure. Well, it's good to start quite early as you can. Maybe I would say both men and women in their late 40s.
Okay.
Even 40, I have patients in their late 30, 35, 36.
And these are highly functioning people.
Highly functioning.
CEOs.
Yes.
Celebrities. How do they hear about you, by the way?
Oh, they'll see from word of mouth, and from my website. So, and of course, I get patients from all over, not only just the U.S., but it's international. So this is what people yearn for.
And not everybody's doing it the same way, by the way.
No.
I interview a lot of doctors, and I try not to put my own views on the show at all.
Yes.
But what's distinctly different with your program is you're big on nutrition.
Yes.
And you are big on stress reduction.
And exercise. And supplements and exercise.
The right kind, though.
Right, exactly.
And I know your age, by the way. You say you live this. You're very lean. You're in great shape.
Well,
you look at least 10 years younger than your age. You think it's because of hormone optimization?
I think,
and because of the way you eat, or is that just good genetics?
No. I mean, no, not. I think the main thing is the lifestyle. I'm sorry. My lifestyle. So it's about nutrition, fitness, hormone optimization.
Is it easy, by the way? Because don't we all know what we should do? We can't do it. Most of the time.
Right. Behavioral change is another aspect of this. So people need, because we know what's good for us, most of us, right? So it's a behavioral aspect.
What's the number one thing that they say? The biggest thing?
Yeah, well...
What do they say?
Yeah, in 7 to 10 days...
they say, Dr. Peters, what? What do they say?
Women, no hot flashes anymore, no night sweats. They feel more energy. They start going to the gym, doing more than they did because they realize they have more energy. So the outlook on life is much more...
How do they become more positive? Just because they have more energy? I mean, does it work with neurotransmitters?
Yeah, I think it's all within the whole process, of hormone. Once you have optimized your hormones, you optimize your neurotransmitters, the thyroid, the adrenals, all your organ functions better. So it's a given that you'll feel much
and this is
better,
a big topic.
Better.
This is a big topic. We said, and we're going to take a quick break. You said, it's such a big topic. I don't know how we're going to get this in. But I mean, obviously, you can't get it all in. When we come back from the break, I want to talk about the commonly replaced hormones, what they're good for. I have questions about testosterone, thyroid, progesterone, estrogen, and growth hormone.
Yes.
Because I've heard a lot of negative things about it. You say it can be good in the right dose.
Sure.
With the right candidate.
Sure.
Okay. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. The next segment, we're going to talk about hormone optimization. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about hormone optimization. With us, we have a leading expert on the topic, trained in France and Italy, and of course here in the United States. With us, we have Dr. Ann Peters. Okay, so people are coming from all over the country. They want to feel better.
Yes.
More energy.
Certainly.
You say that you don't have to age and just slowly wither away.
That's right.
Okay.
Yeah. So
you could stop that. Of course, I'm a little skeptical.
Sure. Well, we have the ability these days with all the new technologies, one including hormone replacement, to feel the best we can. So we optimize our hormones to their optimal levels, actually, so that we kind of mirror the levels we had in our 20s and 30s.
Okay, so you take somebody in their 60s, you replenish their hormones to that of a
30-year-old.
30-year-old.
Yes.
So without even looking at blood work, so I understand this correctly, is your philosophy, the age management philosophy, that basically after 40, no matter what, you're in hormonal decline.
Levels decline.
So
yes.
by giving those back, you feel the benefits.
That's right.
Of that. Of course,
age,
if you eat
that's
right and things like that.
Certainly, we age because our hormone levels decline. That's why we age. So if we replace our hormones and optimize them, then it goes with the saying that we feel much better, and we would kind of avoid or stave off the disease, the diseases that occur with age.
You say the second
time.
half of life absolutely should be the best half of
That's
life.
right.
I mean, you're obviously smarter.
That's right.
After 50.
That's right. That's right. We should have better cognition, memory.
Really?
Focus, concentration. Yes.
Those things come back.
Definitely. Oh yes, many of my patients feel much better. I have a lot of students that have even, patients that have even gone back to school.
Do they ever say, "You've given me my life back"? As cliche as that is.
Oh, definitely.
Do they say it?
Definitely. Oh, you have countless patients who, they feel so much better, and they function, and they cannot believe how they felt before they started.
Okay.
And this is how they feel now.
Good. Well, let's talk about the commonly replaced hormones. What are you looking at?
Well, I look at all the hormones. For instance, thyroid. Okay, it's very, very important hormone because it orchestrates everything that happens in our body, all our metabolic processes. So thyroid is very important. We look at the adrenals, cortisol, DHEA. And we look at the sex hormones, which are testosterone for men and women, estrogen and progesterone. We look at things like pregnenolone, melatonin. All of those are important. Even, aldosterone. There are so many hormones, insulin.
Okay.
That
Growth
are very
hormone.
important. Growth hormone.
Hot topic.
Much, yes.
And that's on your more advanced program.
Yes, exactly.
Let's just suppose somebody's a candidate.
Yes.
Low growth hormone levels.
Right.
Is that something you do once they're balanced? When do you bring it in?
I could give a patient growth hormone in the very beginning. It's not. I don't look at it as you do one hormone here in beginning, and in 3 months you do another hormone.
Okay.
We are going to comprehensively replace the hormones if they are a candidate and if they need it. Okay, so there are certain people who are not candidates for growth hormone for very reasons.
But the ones that are, what's it good for? What's it good for?
Question is, what is it not good for?
Okay.
For
so skin,
the external appearances, tone, color, texture of your skin improves.
Women are doing this.
Oh, certainly. I have people who haven't seen their friends for a long time, and they look at them and say, "What are you doing?"
But you're not going to get big with growth hormone?
No.
Okay.
No, because
is that a misconception?
That's well, because people abuse anything, right? So
too much, you can
too much. So so I do it at a very conservative dose and optimal dose at the same time, so you see the benefits you're looking for.
I've heard Hollywood celebrities have embraced this.
Yes.
This is a big secret little group of people that do hormone balancing, hormone optimization.
Right. Well, it makes them perform better because they are very high functioning people, right? So they want to feel better and do the schedules, keep on their schedules that they need to. So like other professionals. So it helps us internally too. Getting back to that, like the cardiac muscle works better. The lungs, your spleen, liver, everything works better. All your organ systems works better because of growth hormone. And also, the very important thing as people get older, they think of memory, cognition, functioning, and concentration, focus. So that's very important to keep the mental sharpness as they get older.
So people that have a partner, one goes in.
Yes.
They do the program.
Yes.
They feel so much better.
Right.
Do they usually go and drag their partner in?
Oh, definitely. I see it all the time.
This is what happens all the time.
Yeah, either they come in together initially, or one person starts and then they say, "Oh my gosh, I think my wife or husband could use this," and they bring them in. It used to be more women coming in initially, but now men are coming in and bringing their wives in. Because it's
interesting.
It's very critical. I think this is critical to healthy living and healthy aging.
Healthy aging.
Yes.
So how do you think, if you got somebody, so general, good health, they start eating right, exercising right, the right kind of supplements, stress reduction, hormone optimization, you think if you caught them at 50, that in their 80s and 90s, they could be acting like a 50-year-old?
Oh, certainly. I mean,
you believe that, really?
Oh, certainly. Well, I could give you an example. I have a patient who was in his early 80s who came to me with a cane, walking into my office. And he had every, symptom you could known to a man. For instance, decreased energy, low sex drive, low libido. He
wanted, he's 80.
Yes, he's 80 years old. Right. And he didn't have the energy to exercise. He could only walk one block and back home again. So he wasn't very happy with where he was feeling, even at 80s, in the mid 80s.
Yeah.
So I started him, checked his blood levels, started him on a program that was appropriate for him. And then, I got a call maybe a month later from his friend who they were on a cruise ship to Alaska. Yeah. And he was dancing and without a cane and, having a great time on board. And, they were concerned. His friend was concerned and asked me, is that okay? Could he do all this? I said, of course, he feels much better. And he said, I gave his life back, gave him back his life because he felt so much better. After starting testosterone and DHEA, those are the two main hormones I put him on. And, most
Is this
men
one of those
do that.
things where they say, men and women, they'll say, I should have done this years ago?
Oh, definitely. And
really?
Yes, certainly. People are being more proactive. So they are coming to me at an earlier age now, in the late 30s. And some people are even having the levels done quite early. So they feel good now. And then 10 years from now, then they could compare how they feel and, look at the levels back then. So they optimize the levels to where they were back then, back 10 years ago. Right. So they feel a lot better.
So an anti-inflammatory diet. We haven't talked a lot about your exercise philosophy and approach.
Yeah, I can't go into all of that because there's a lot, but suffice it to say there is, factors involved are like flexibility training, cardiovascular, strength training, resistance, all of these are critical to keeping your lean mass.
Now, we are just about out of time, but you have a detox element to this.
Yes.
Explain that, because when I think, obviously, detox, drugs, alcohol, but this is different.
Yes, certainly. Because, the liver processes everything we put into our bodies, and we need to detox our liver. Our gut, intestinal tract is also needs to be detoxed. And,
so you have cleanses, I'm reading here, probiotics,
yes, exactly.
Micronutrients.
That's correct. Because how will you be able to absorb the good nutrition if you have a toxic gut with yeast overgrowth and,
So
toxins?
These people get detoxed as just part of the program?
No, but actually it's those who need it.
Okay.
Yeah, those.
Some people come to you, they're highly functioning, they just want to take it up a notch.
Right.
And some people come to you sick.
Yes, so I recommend highly that they go through a detox program to get rid of toxins and alcohol.
So
is
they
a big
heal
use.
their body?
Yes,
in a way.
yes.
Okay.
So it's ready for absorb the nutrition, the good nutrition.
Is it cold turkey? Do you taper them off
I
slowly?
taper them off slowly, yes. Yeah, it's not something that's done, overnight. So yeah, it has to be done slowly, and so it's preparing the body for the good nutrition. I think it's our lifestyle that people need to be very serious about, especially.
So it is a lifestyle.
Yeah, of course.
We always hear that,
yes,
but I mean, it's really this longevity.
It's a lifestyle.
Lifestyle.
Yes, 10 years from now, 20 years from now, you want to feel better than you are, or not feel worse than you are today. So it's something you look for, to keep up as years go on. When you get to the 80s and 90s, you still feel good and you have the good habits so that you avoid all age-related diseases.
Now, I know a female, a 50-year-old dentist.
Yes.
She says, Randy, when I started doing this, my skin got better, my wrinkles went away. It's not like a big exaggeration. She says, I got lean, my body fat went down, I started seeing my muscles again, my libido's through the roof.
No.
Really?
That's exactly.
Because I always think it's a bit of an exaggeration.
No, that's a typical benefits I see for myself and my patients. So it's not an exaggeration. No.
Is that right?
Yes.
We're out of time. Very interesting. Big topic. This is all on your website.
Certainly,
as well.
Yes.
Okay. And but final message. Somebody watching this, maybe they're 40, 50, and everybody wants to feel fantastic. Okay, maybe they're skeptical, maybe not. Give us a recap.
Yeah. Well, in closing, I would say that people do want to feel better as they go into their 50s, 60s, and 70s. They want to do things they did before, like go skiing. I have patients who do heli skiing, you know,
really?
and they take, yes, and we adjust their levels so they have more energy, you know, when those times comes around that they want to do these extreme sports. I mean, we are able to do what we did when we were in 20s and 30s, now in our 50s. You know, if we optimize our hormones, eat right, and do fitness, and you know, we will live fulfilled lives, because we all want purpose in our lives as we get older. You know, so life doesn't stop at 50 like it did years ago.
Okay.
So there is
on the telephone. I loved it. You know, I said, "Tell me about your program," and it was really the first thing you said, and I wrote it down. You said, "My program allows people to do more of what they like to do."
Exactly. So
and I didn't quite catch it when you said that.
Yes.
But you're saying because of the increased energy.
That's right. Then now
they
have
golf more. You can
certainly they have a renewed purpose.
Run and a renewed purpose.
Certainly a renewed
it's like a
purpose.
second chance now.
That's right, and they are fulfilled as
Interesting.
people. Yes, because why should we live longer if we don't have, you know, the quality of life and the reason for living longer? And once you start replacing hormones, people's lives will change. I mean,
so is this the new way of aging gracefully?
That's
this is it. This is the new way to age.
Definitely.
Hormone optimization.
Definitely.
Well, thank you for coming on the show. Very good.
Thank you, Randy.
Excellent. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again or point a friend to view it, you can go to our website at wellnesshour.com and just type in Dr. Peters or hormone optimization. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.